Hello everyone, welcome back to my channel. I'm Dr. Monisha J. Shetty here. So today we'll be learning easy mnemonics for anticholinergic drugs. Let's get started. We'll be starting with classification followed by mechanism of action and then adverse effects and uses. Classification of anticholinergic drugs is divided into natural alkaloids, semi-synthetic derivatives, and synthetic substitutes. Coming to natural alkaloids, mnemonicus HAT, H for hyoscine, that is copalamin, A for atropine. Now coming to semi-synthetic derivatives, mnemonicus Hitachi, H for homotropin, I for ipratropium bromide, T for thiotropium bromide, H for hyoscine butyl bromide, A for atropine methonitrate. Synthetic substitutes is further divided into mydriatics, antisecretory antispasmodic, vasoselective, and antiparkinsonian. Coming to mydriatics, mnemonicus CAT, C for cyclopentolate, T for tropicamide. Antisecretory antispasmodic is further divided into quaternary compounds and tertiary amine. Coming to quaternary compounds, mnemonicus COPG, C for clydinium, O for oxyphenonium, P for propanthelin, G for glycopyrrolate. Now coming to tertiary amines, mnemonicus deprival, D for dicyclomin, P for perenzepine, V for valethamate. Coming to vasoselective, mnemonicus soft, O for oxybutynin, F for flavoxane, T for tolteridine. Now coming to anti-Parkinsonian, mnemonicus butyp, B for piperidine, T for trihexyphenidyl, that is benzhexol, and P for procyclidine. Mechanism of action. Here, competitive antagonist, that is atropine and scopalamin, they bind to the muscarinic receptors and in turn block the action of the agonist, which is the acetylcholine. So this antagonism is reversible, that is by increasing the concentration of the agonist, that is acetylcholine. And these antagonists are non-selective and they block all the subtypes of muscarinic receptor, that is from M1 to M5. Adverse effects. Mnemonicus buddies caffeine Delhi, B for blurred vision, U for urinary retention, D for dry mouth, D for dysphagia, S for skin rashes, C for constipation, F for fever, D for dry skin. Now on high doses, the adverse effects that are seen are mnemonicus perfectly pitched, P for palpitation, R for restlessness, F for flushing, C for convulsions, P for psychosis, C for coma, H for hallucination, and D for delirium. Uses. Mnemonicus complementary backpack, C for cycloplegic, O for organophosphorus poisoning, M for mydriatics, P for pre-anesthetic medication, L for labor, M for motion sickness, A for antispasmodic, B for bronchial asthma, P for Parkinsonism and peptic ulcer.